Good evening, everyone. I'm Dr. Kurt Woeller. I appreciate you joining me tonight for this webinar called Chronic Stress and Adrenal Insufficiency in Autism and Mental Health Disorders. I think you'll find this presentation very informative. I'm not only just going to talk about autism, but also tie in some aspects with respects to mental health problems with other patients too. But there's a lot of crossover, and the information is very applicable in many ways. So let's go ahead and get started. If this is your first webinar, I have been doing these webinars with Great Plains now for quite some time, I think 3+ years, maybe going on 4 years. And I've been very involved in patient as well as physician, healthcare practitioner education. If you want to get more information about me, you can do so through my main website at drwoeller.com. There's a place to enter your name and email address to get mailings from us, current events, updated information, links to books that I've written, seminars that I'm speaking at, etc. So you can access that through drwoeller.com. So what are we going to talk about tonight? Well, first off, we're just going to go over some brief statistics on autism and mental health. We're going to talk about the function of the adrenal glands, and then we're going to introduce the concept of the hypothalamus pituitary adrenal axis. What's that connection? And then linking that to something called the chronic stress response, and something that probably people within the biomedical community haven't heard about before is something called pregnenolone steal. This is a concept that is known quite well in the functional medical model, which is practitioners who are looking at adrenal issues or thyroid issues or hormonal imbalances. They would talk a lot about pregnenolone steal, and I'll introduce that concept here for you. And then we'll talk about chronic stress in general between the adrenals, thyroid, immune, and how that can impact the detoxification system, and then we'll wrap it up with respects to examples of adrenal support therapy. In these presentations, by the way, I don't have time at the end to do any question and answers. However, if you do happen to post a question, I will receive that, and then I'll respond back through Great Plains based on your question. So, autism. What are some of the current statistics? We know it's a big problem. Centers for Disease Control estimates that about 1 in 110 children have a diagnosis of autism. Honestly, I think those rates are quite higher. This is more of an average across the U.S. There are certain areas within the United States that the rates are definitely higher. Autism affects approximately 8% of the 4 million babies born each year in the United States, so it's a huge, huge percentage. And this diagnosis is actually outpacing cancer and AIDS with respects to developmental disorders. With respects to mental health disorders, clearly there's a broad spectrum here, because you could be dealing with bipolar, schizophrenia, mood disorders, depression. But approximately 26% of Americans 18 years and older, about 1 in 4 adults, in any given year will suffer from some type of diagnosable mental health disorder. So those numbers are huge, and as I mentioned, that includes mood disorders, depression, bipolar. 40%, there's been a 40% increase in antidepressant medication prescribing since 1998. So the issue is getting worse, and nearly 1 in 10 Americans over the age of 12 is on some type of antidepressant medication. And to me, that's sad. That's a reflection not only that we have truly an epidemic of mental health problems. We clearly have a lot of young people today being put on these medications, and honestly, a lot of them unnecessarily. If people were to step into and understand the concepts of nutrition and food sensitivities and biochemical imbalances, I think that number could be cut back significantly. And in the United States and Canada, mental health disorders are the leading cause of disability. So we're talking tonight about the adrenal gland and how some of this ties into what we see with respect to autism and certain mental health conditions. So what are the adrenal glands? The adrenal glands are actually a small gland. They're a triangular shaped gland that sits on top of both kidneys. So we have one on the right kidney as well as the left kidney. So we have the right adrenal gland and the left adrenal gland. And what they do is the adrenal gland is essentially made up of two parts. We have an interior section, the inner part called the medulla, and an outer part called a cortex. The inner part is what produces a number of these adrenaline-like hormones. The outer cortex is what produces various things like what are called corticosteroids. And this would include cortisol, aldosterone to help regulate mineral production, sodium, potassium, and also certain male sex hormones come from the adrenal glands as well. When we have a problem where primarily the adrenal gland, but we're specifically, if we're really looking at it, specifically the cortex of the adrenal gland starts to fail or just completely burns out, there is a disease condition called Addison's disease. Now, Addison's disease is where the adrenal glands fail to produce hormones, and there's a wide spectrum of things that people can manifest. They can manifest with skin changes, weakness, fatigue, lightheadedness, pain, many times abdominal pain as well as joint pain. But there can also be psychiatric symptoms that go along with Addison's disease. Anxiety is quite common, mood and personality changes and depression are quite common, and in severe cases, psychosis and delirium that often can be difficult to diagnose unless a doctor takes the time to actually start doing some blood work, looking at serum cortisol levels, looking at what's called ACTH levels, pituitary function, to see if there's an underlying metabolic problem instead of just assuming somebody's dealing with a purely psychiatric issue. So the psychosis and delirium attached to Addison's is rare, but it can be seen in severe cases. Now, even traditional medicine or conventional medicine recognizes the concept of adrenal insufficiency. If you go online and you Google adrenal insufficiency and mental health, adrenal insufficiency and autism, you are going to come across some websites that try to disparage this information, saying that this is all hokey pokey and doesn't exist. But the reality is it does exist, and even the National Institutes of Health have a well put together document, a patient education document, a PDF, which I linked here, that specifically talks about adrenal insufficiency, what it is, what can cause it, what it looks like, and also what are the treatments available. Now granted, the treatments tend to be fairly traditional in the fact that we're replacing lost hormones, using cortisone, such as prednisone or hydrocortisone, fludrocortisone, which is a chemical equivalent to aldosterone to help regulate sodium and potassium levels. So, and sometimes people have to take these through injections, and that's what this document is talking about. But I wanted to bring that concept to you because traditional medicine, according to the National Institutes of Health, recognizes that adrenal insufficiency is a real medical problem, despite what you'll often hear on the internet. Now, I mentioned this interaction between the hypothalamus, the pituitary, and the adrenals. So what is this hypothalamic pituitary adrenal axis? Well, this diagram here shows you that within our brain we have this area called the hypothalamus. And the hypothalamus secretes this chemical called CRF, and CRF flows down into the pituitary and tells the pituitary to output something called ACTH, which I'll talk about here briefly. That ACTH is released into the bloodstream. It flows down to the adrenal level, stimulates the adrenal cortex, and tells the adrenal cortex we need more cortisol. That cortisol then has various metabolic effects throughout the body. When the level of cortisol gets high enough, we get a feedback mechanism up to the brain to tell the brain to shut down its production of CRF. What is the thing that causes the hypothalamus and the brain to release these chemicals? Well, it happens to do with stress, and we're going to talk more about that here shortly. So this is a slide or a cross-section of the brain with respect to the brain anatomy. And I wanted to just point out where the hypothalamus is. It's this little anterior section of the brain, well protected in the brain, and it's connected down this little tube structure to the pituitary. So the hypothalamus is the control center for most of the body's hormonal systems. There are cells in the hypothalamus which produce this hormone called CRF, corticotropin releasing factor, and it does so in response to any type, and this is important why I put it in bold, any type of physical or psychological stress. Okay, so the hypothalamus secretes CRF, which then binds to specific receptors on the pituitary, this little tube-like structure that hangs off the hypothalamus, which then the pituitary produces adrenal corticotropic hormone, or ACTH. That ACTH is then released into the bloodstream. It's then transported to the adrenal glands and then stimulates the production of adrenal hormones at the adrenal level. So here we are again. We have a cross-section of the brain. We have this green-like structure, the hypothalamus, which is connected to the pituitary. Notice these different lobes within the hypothalamus. We have lobes that control appetite. We have lobe that controls the sleep-wake cycle. We have lobe that controls thermoregulation, reproduction, hunger, water balance, and stress. So it's a really small structure, but it's critically important to our overall body function. The adrenal glands, after they're stimulated by ACTH, secrete cortisol. The release of cortisol initiates a series of metabolic effects that are aimed at essentially eliminating the harmful effects of stress, and we'll get more into that, okay? And then through a feedback mechanism, when the body has resolved that stress event, the brain turns off its production of CRF, the pituitary decreases its output of ACTH, and the adrenal glands at that point would then turn off or decrease its overall production of cortisol. So again, this graph here just shows us what's happening. CRF goes down, ACTH goes down, cortisol goes down, and everybody's happy. If there's more stress, the whole event starts all over again. Now, one interesting side note in autism, and this was a slide taken from a presentation I have on the overall brain function seen in autism with respects to neuroanatomy and neurophysiology. And I highlighted within this slide why we may see certain issues with some kids on the spectrum, such as feeding problems or excessive drinking or satiety issues, or maybe kids are not responding properly to melatonin to help with sleep, so their sleep cycle is still off. Some of it could be that there is just a dysfunction happening at the hypothalamic level. Now, it's not easy to test for. It's difficult to prove. There's not a lab test that you can do per se all the time that's going to tell you a specific problem, or an imaging study that might indicate such. But I've seen kids who have these sort of ongoing problems despite the fact that they're improving with other types of therapies, whether they're improving with diet or nutrition or methylation support or treating yeast, but they still have some unresolved issues that are occurring. Let's say I've had some kids where they're never satisfied with respects to eating. They always seem hungry, or they're excessively thirsty. So there could be some issues that are going on here deep at the hypothalamic level. All right, so let's introduce now the concept of the chronic stress response, or what's also called the stress-induced hormonal imbalance. So what is stress? Well, the definition of stress is a force that can either strain or deform. It can be chemical, it can be emotional, it can be physical, and it either causes the body or causes mental tension that may be a factor in disease causation. And there are many forms of stress. I mean, as I mentioned, physical stress. You could have a nerve injury, nerve compression, a fracture. That can lead to chronic stress. Emotional factors, mental factors, fear, excitement, worry, anxiety. And we've got to think of these things as some of these things are acute and some of these things are ongoing. If somebody has a chronic state of anxiety, that is going to be a chronic stressor. If somebody is a constant worrier, that is going to be a mental form of stress. Excitement can also be a form of stress. Let's say, like here where it talks about job, family, location. Moving to a different location, although that might be an exciting thing, also brings stress. Getting a new job can be exciting and beneficial, but it can also be stress. And of course we have other factors: chemical, food, heavy metal, chemical, toxic food, vaccine reactions. These things are multifaceted and they can be cumulative and just have a chronic input into how our brain perceives stress and the output of these hormones that regulate cortisol production at the adrenal level. I made this slide a long time ago because I tried to break it down and get an idea. And the patients that I had worked with for many years, whether they're kids on the spectrum or adults with a wide variety of issues, chronic fatigue or heart disease or certain people with mental health problems. And what I realized is that really the number one thing that tends to cause a dysfunctional cortisol response, a stress response in our body is mental emotional. It's how we perceive an event, really rather than the event itself. And it truly is the most important thing that generates that stress response. The second most important thing that tends to cause problems for the vast majority of us is imbalanced blood sugar. The overconsumption of simple carbohydrates, and this is going to include kids, not just kids on the spectrum, but kids in general, leads to rapid elevations in blood sugar, which ultimately just leads to this roller coaster phenomena of insulin response, cortisol response, insulin response, cortisol response, imbalances of blood sugar, and if it's severe enough, it can contribute to behavioral problems, learning problems, memory issues, headaches, fatigue, anxiety, and I've seen a number of kids on the spectrum who have poor blood sugar control, and they are very erratic emotionally and behaviorally. The number 3 causative factor for dysfunctional cortisol and stress response essentially is everything else. And what is everything else? Well, it has to do with everything else that we may be exposed to. Toxins, food sensitivities, chronic infections, etc. When we have a stress response that's chronic, we over time will develop chronic disease. The vast majority of diseases that we suffer with in our society are because of a chronic stress response and a dysfunctional breakdown of our body systems. Diabetes, cardiovascular disease, infectious diseases because of the susceptibility to infections, GI issues, autoimmune, increased drug sensitivity, the list goes on and on and on. And so could we throw autism in this case? Absolutely. Can we throw the vast majority of mental health disorder in this category? Well, we certainly can. I don't want to indicate that everybody's mental health disorder is purely because of an adrenal insufficiency problem, or that all kids' autism is going to get 100% better if we just work on adrenals. But we know that the adrenals have a major role, not only physiologically, but psychologically as well. This slide here is a graphic representation of the progression of what's called adrenal exhaustion. And when we're in a normal state, we obviously have a normal output of adrenal hormone, cortisol, regulated throughout the day. When people are in what's called a stage 1 adrenal exhaustion level, actually the vast majority of their cortisol levels are high. What I have found in clinical practice is that these are the type of people that you usually don't see. They don't necessarily come in for appointments because many people are still functional at this level and they don't really have a lot of physical complaints. However, you will often, or you will at times, see people who are in a stage 1 adrenal problem if they've had an event of acute stress, or they've had some chronic infection or some type of an acute inflammatory issue where those levels are quite high, or somebody who is like a type A personality, poor sleep, etc., where you just sort of happen to catch the adrenal profile at the time that it's about ready to kind of slide off and do a stage 2 level. When our cortisols are high, our body is in a fight or flight mode, which means our sympathetic nervous system is often up, and that cortisol levels many times is helping to control inflammation. But there are other adverse effects that can happen if our cortisol levels are chronically elevated. An acute sort of rapid response for a short period of time is normal, but it's when these situations become daily, weekly, and monthly that we start to run into problems. And then as we start to slide off the back end, this is where we slide into what's called stage 2 and stage 3. This is where the vast majority of people that I see exist, including the kids on the autism spectrum that I see. Generally they're in a stage 2 or stage 3, where most of the cortisol levels are low or low normal. They're suboptimal. Sometimes adults will manifest with headaches or sleeping problems or fatigue or weakness. I don't see fatigue so much in many of the kids on the spectrum, but we certainly can see irritability, distractibility, moodiness, etc. And then, of course, as you keep sliding further to the right, you hit the failure mark, which would be Addison's disease. Now, this is a normal adrenal profile, and you can see here each individual cortisol level is right where it should be. This is a salivary adrenal profile. This is my preferred way of doing it. I feel that it gives more accurate assessment throughout a 24-hour period of time. When you're doing a salivary adrenal profile, you're looking at the free fraction of that hormone versus doing a blood test, which most of the time you're only getting one sample in the morning. And so this is what's called a functional test. It gives you a graphic representation about what's happening over a 24-hour period of time. And each of these values ideally should be somewhere in that upper 2/3 of normal range with respect to their individual reference ranges. This is an individual who's actually in a stage 1 where you notice that their morning cortisol is elevated. Their noon and afternoon are normal, and the afternoon is actually slightly low, and then their nighttime level shoots way up again. Now, I can pick apart sort of some of the common reasons why this might be happening. Oftentimes when we see morning cortisol levels elevated like this, it's either because of poor blood sugar control throughout the night, or it could be a chronic infection. Could be chronic yeast, bacterial, or a parasitic infection. This could also be from an individual who works the night shift. So they sleep during the day and they work at night. Notice that the cortisol levels are elevated at nighttime, and often cortisol levels at night can interfere with sleep. So these types of things kind of have to be determined, and the adrenal profile is a great way of doing that through the saliva testing. So bringing this back, mental emotional stressors, again, that perception of life events lead to this mental emotional response. We start to get electrical changes in the cardiovascular system, the nervous system, which has an effect on our immune and hormonal system, and over time through the sympathetic nervous system, leads to, or one example of this is if we have a chronic output of the sympathetic nervous system, that fight or flight response within our nervous system, over time that can cause a suppression of our immune system, particularly the immune system in our digestive tract, that secretory IgA, that first line immune defense that builds up our intestinal lining and protects us against infections and excess food sensitivities. As that secretory IgA is compromised, we have a lower immune defense and we're that much more susceptible to infection. Okay, so this is sort of redundant here, but anything that causes an increased production of ACTH from inflammation, from pain, from poor blood sugar control, from mental emotional stresses is going to cause an increased production of cortisol. Well, what are some of the more common reasons that this can happen aside from a mental emotional perception of a life stress event? Well, it turns out that one of the most common sources of what's called clinical and subclinical stress, by the way, would be things that you don't necessarily feel physically in your body, but a subclinical stressor could be an infection. Now some people say, well, I mean, if you had an infection you should feel it. Not always. I have seen many kids on the spectrum, as well as adult patients that I've tested for parasites, don't even know they have a parasite until it shows up on a stool test. But Giardia or Cryptosporidium or some of these amoebic parasites can cause stress within the GI tract and then stress within the body, and that is a contributing factor. So chronic infections can be a problem. And then obviously the longer this chronic stress response is going on, the more risk we are with respect to hormone, immune, and metabolic issues. And it's not just chronic infections. It's this whole gamut of things, from the foods to the chemicals, etc. They all have an impact on the production of ACTH. Because one thing I want to point out is the stressor doesn't matter. The brain doesn't differentiate stress from, you're running late because you have to get to work, or you're sick because of the flu, or you ate gluten because your body didn't tolerate it well, or you got a vaccine and you had an adverse reaction. The brain doesn't perceive that stress any differently. It's going to perceive stress and output ACTH because of it. And so the impact essentially is going to be the same. This is a great slide. It's a complicated slide, so let's go through it. So I'm going to keep this up here for a little bit. On the left, you'll notice where it says anger, fear, worry, anxiety, guilt, late hours, surgery, trauma, temperature extremes, chemicals, on and on and on. Those are those potential sources of stress that honestly all of us are susceptible to. Certainly our kids, certainly we are, and other people as well. So if we took this list, you could apply this list to an individual with a mental health problem. You could apply this list to yourself. You could apply this list to perhaps your child on the spectrum. Okay, what could be affecting them? If we think about autism, what do we commonly go after? Well, we commonly go after allergies. We'll often look at nutritional deficiencies. We'll look at maldigestion and malabsorption. We'll certainly look at infections. We'll definitely look at toxic exposures, heavy metals, for example. We certainly know that a lot of kids on the spectrum have inflamed digestive systems as well as inflammation neurologically. Some of the kids aren't sleeping well. Many of the kids have anxiety. Certainly there could be a component of chemical imbalances in the brain. All of that could be a perception or a chemical inducer of stress. So what happens when we have these kind of things going on? We have what's called sympathetic nervous system output. What happens is that the brain or the body produces epinephrine. and norepinephrine, which tells the hypothalamus, which is HP, to output ACTH. Now, if we think about this from let's say, an acute standpoint, would be a normal response. Let's say we have an injury of something where we twist our ankle. And so we have an output of adrenaline, tells the hypothalamus to output ACTH. ACTH tells the adrenal cortex to output cortisol. Cortisol then does its thing, tries to decrease the inflammation, mobilizes the immune system to try to sort of seal off the injury. But after that's been done, the situation should turn off and everything goes back to normal. But chronic stress, we just have a chronic input of chemical input into the hypothalamus. We have a greater and greater output of ACTH. We have a greater and greater output of total cortisol and free cortisol. And after a while, the hypothalamus starts to lose some of its sensitivity. It starts to downregulate its sensitivity to that ever-present cortisol. It's not continuing necessarily to regulate itself and turn itself off. The problem when we have chronic output of cortisol is that over time we'll start to run deficits in DHEA. And DHEA is critically important because DHEA has a regulating function over the immune system, metabolism, as well as hormone production, specifically testosterone and estrogen. So if we start to have a skewed effect with respect to the ratio between cortisol and DHEA, over time we're going to have a problem with energy production. So insulin sensitivity goes down, glucose utilization goes down, blood sugar goes up, what's called gluconeogenesis goes up, and now we're setting ourselves up for diabetes, metabolic syndrome X, heart disease, and everything in between. We can also start to break down our bones, we break down our protein, we break down our muscle tissue, we start to have salt and water imbalances. That is going to disrupt our body pH, it's going to disrupt our kidney function, our liver function, and we run a host of problems there. And then finally on the right, if you think about a lot of the autistic kids, they tend to have a lot of chronic infections. When every time we start with a chronic stress issue, we start to have a negative impact on the immune system, and that just increases the susceptibility to chronic infections, whether it's candida, bacterial, parasitic, or viral. And this concept, or this shifting principle of cortisol to DHEA ratio being skewed, is called pregnenolone steal, or what's also called cortisol escape. And let's look at this a little bit further. This chart here is the principal pathway of steroidal hormone production in the body. Notice up on top we have B5 leading into acetyl coenzyme A. Now you probably heard of acetyl coenzyme A because it's also a cofactor in energy metabolism. But notice also that acetyl coenzyme A feeds into cholesterol. We have seen over the years, Great Plains actually has a great test for this, but I've been documenting this in my practice for years now, that many, many kids on the autism spectrum are very low in cholesterol. I've also seen certain individuals with depression and other mental health issues also have low cholesterol too. That doesn't mean all of them do, but a good percentage have low cholesterol. I don't have the time to go into all the biochemistry of cholesterol, but we know from this discussion cholesterol is an important precursor to steroidal hormone production. Cholesterol is also found in the brain. It makes up the bulk of myelin that surrounds our brain cells. It makes up a percentage of the cell membrane. And in autism specifically, it has a link to oxytocin because it has a regulating function over the affinity of binding of oxytocin and the function of oxytocin receptors. And we know that oxytocin has an important role with respects to bonding, decreasing anxiety, and improving the facial expression and voice cue emotional recognition that's often lacking with some of the individuals on the spectrum. But as we take it back to this graph, this graphic representation of hormones. As we come down, the first thing we hit is pregnenolone. Pregnenolone I call a master switch hormone. Okay, it can go in various directions. It can move downwards towards dihydroepiandrosterone, or DHEA. DHEA can move down to become testosterone. DHEA can also move down to form various estrogens, estrone, estradiol, and estriol. Okay, so DHEA is a critical hormone for overall hormonal balance. Pregnenolone can also become progesterone, and that's important because progesterone obviously has an effect in women. It's necessary for reproduction, and it's also important for sleep. We also can form aldosterone, which has a regulating effect over sodium and potassium balance at the kidney level. So in a perfect world, all of these different pathways should be getting their exact percentage of hormonal precursors to keep everything in balance. The problem is when we are under chronic stress, the preferential pathway is to cortisol. Okay, and this is what this red arrow indicates. We start moving pregnenolone through progesterone and down to cortisol, and essentially we are now in a chronic state called pregnenolone steal. And what you'll see is cortisol levels being skewed from a ratio perspective with respects to DHEA, and then over time you'll start to run into dysfunctions with respects to testosterone, estrogen, and sometimes aldosterone. Now, cortisol has a regulating effect at the cellular level, specifically at the level of the nucleus of the cell. And what happens in the nucleus of the cell? Well, through DNA transcription, we produce RNA. RNA is necessary to produce various proteins that have a regulating effect throughout our body, our immune system, our cardiovascular system, our brain, etc. Okay? So when cortisol is dysfunctional, over time we will have an impact on every cell in the body. A dysfunction within the hypothalamic pituitary adrenal axis, that connection between the hypothalamus to pituitary to adrenal, and the dysfunction that ensues because of an imbalance in cortisol production will have a negative impact on thyroid function. So some people will come in and actually manifest with symptoms of low thyroid. They may be fatigued, they may have constipation, they may have weight gain, they may have dry skin or coarse hair, and the doctor does test and finds that their thyroid level is low, and then automatically just put them on thyroid hormone, and they feel better for a period of time. But what a lot of people fail to understand is that you can have a thyroid issue that is being caused or contributed from because of an adrenal issue. So in my preference, what I like to do if we can, and it's not always achievable with some of the kids because of the difficulty in collecting saliva samples, but from a general patient perspective, if we can do it, is to not only assess thyroid, but to also assess adrenal function. And because if the adrenals are weak and the adrenals are not working properly, we still may give thyroid replacement therapy, but we should also be doing some things with respect to the adrenals too. And in the future, I'll be doing a presentation actually on thyroid function as well. So this is an important slide. What do the adrenals have their hands in? You know, if we think about that balance between cortisol and DHEA, well, they have their hands in almost everything, from cellular metabolism to musculoskeletal health to brain function to the quality of sleep. Again, as I mentioned, to thyroid function, blood sugar control, the way our body processes fat and protein, detoxification. This is a big one, obviously, for kids on the spectrum, but you know, a lot of people have detox problems. You know, controlling inflammation. So there isn't there really isn't a system that this discussion doesn't apply to. This slide here is from an individual who is now in stage 3. This is where each individual cortisol level is now low. Okay, so they had, in order to get to stage 3, they had to have gone through stage 1, where the levels were high, stage 2, where there's a transition point, and then finally they're ending in stage 3. And I have found that many people with just chronic health issues can exist in a state of stage 3 adrenal insufficiency for years. They may never get to a stage 4. Not everybody progresses to Addison's. Okay, that's an extreme situation. So you can have a functional imbalance, which basically means you're still somewhat functional. You can get through your day, but you're not optimal. And this is where the cortisol levels are severely depleted. And so it becomes important from a biomedical standpoint of how to intervene. We can give adrenal supplements that just support adrenal function, or you can give specific adrenal remedies tied specific to each individual cortisol value at that particular time of the day. And oftentimes that's necessary to do to try to optimize cortisol and adrenal function over time. So, would this picture of adrenal insufficiency at stage 3 lead to fatigue? You bet. And it certainly can lead to overwhelming fatigue. And we certainly know that for the vast majority of people with chronic fatigue are going to have also some level of dysfunction at the mitochondrial level or the cellular level, where we're producing these energy chemicals. Now again, as I mentioned, I don't often see fatigue in, a lot of the autistic kids, although I've had kids who are, they don't have any energy, or they're very lethargic, but they're not certainly like you see in adults with sort of chronic fatigue. But when we talk about a lack of energy metabolism or poor mitochondrial function, what that means is that the ability to regulate the body with respects to stress is compromised. So people are more susceptible to mental and emotional imbalances, anxiety, moodiness, depression, but it can also hit at a physical level too. Immune function can be compromised, digestive function can be compromised, etc. So I don't always want to give the, when I talk about adrenal insufficiency or adrenal fatigue, that somebody's just sitting around lethargic, because clearly that's not always the case with kids on the spectrum. The reality is that some of the kids on the spectrum who are hyperactive, who have attention problems or hyperactivity, many times will actually have poor adrenal function, but they've just got this this wiring effect that's going on neurologically, this chronic stress response that's going on neurologically that allows them to compensate. So one of the reasons that I love the organic acid test from Great Plains is because it helps to identify different levels of metabolic insufficiency within the mitochondrial function, as well as the other things that we can identify through the organic acid test: yeast toxins, bacterial toxins, etc. But anytime when we talk about adrenals, we should also be talking about what's happening at that cellular level. Because remember, I showed you that slide with respect to cortisol and cortisol's influence in the nucleus of the cell. Well, if we've got cortisol flooding the cells and causing disruption at the cellular level, you can bet we're going to have disruption of energy metabolism in the mitochondrial level as well. So what are some things that we should be looking at? What are some things that are important to recognize with respect to chronic stress from a physical level of things that we can test for? Well, you got to check for infections. Remember the slide where I talked about chronic infections being a major contributing factor to chronic stress, and that clearly is the case whether an individual has digestive symptoms or not. Okay, one reason I always do an organic acid test is because I want to evaluate for yeast and bacterial issues. I'm not always able to do stool testing on every patient, and some of it's because of finances, some of it's because it's difficult to get. However, it's an important test to do if it can be done to try to evaluate for chronic infections that can be isolated. So what we call the war in the intestines is real important. Also, blood sugar control is important. This is a slide that is showing you the ratio between insulin and glucagon, which helps to regulate blood sugar. And insulin levels are very high. Over time, that's going to cause issues with respect to blood sugar control, insulin sensitivity, precursor to diabetes. So really what we're trying to get is an optimal level of glucagon to insulin, about 72 to 28%. And just by improving protein consumption by decreasing sugar and simple carbohydrate consumption is really key. Now, this is a whole discussion in itself about glycemic control, but one of the things, if you're a parent out there on the autism spectrum, we certainly know that the gluten casein-free diet is a very important diet for the vast majority of kids who try it. But what I have found over the years is that you can do a really unhealthy gluten casein-free diet. You can get a lot of gluten and casein-free foods that are loaded with sugar. So the concept of nutrition with respects to adrenal function, we have to bring it into the realm of trying to just improve the overall quality of food, as well as just a more whole food diet in general. Because the vast majority of us, and particularly our kids in today's society, eat way too much sugar and way too much carbohydrate. So even just learning some of the concepts of the paleo diet, what's called the caveman diet, trying to get back to food that's not processed, it's things that Mother Nature makes, and obviously then tailoring it, to specific food sensitivities. One of the other tests that I'll do with many patients, whether it's kids on the spectrum or adults who have chronic health issues, mental health issues, or joint pain or fatigue, is a comprehensive food sensitivity, because it's important to look at what the immune system is seeing as a problematic food, because again, it can lead to chronic stress. Sleep. I mean, we all know that sleep is important, but oftentimes it gets overlooked. One of the first questions I like to ask parents is your child sleeping? Because if they're getting adequate sleep, that means that generally you as a parent are getting sleep. If you're an adult who's suffering with some of these issues, sleep is a big deal. Okay, so sleep is absolutely essential for repair and recovery of our physical body, but also our nervous system. And it's almost impossible to get adrenal function, hormonal balance back online if you're not sleeping adequately. So we know that insomnia is a major complaint of many people. It certainly is a big problem with the kids on the autism spectrum, and it's one of the things that I try to resolve. Sometimes it's easy just by removing foods that the kids are sensitive to, or sometimes using melatonin if needed. So there's a number of things that can be done to help with sleep, but we have to recognize sleep and the imbalances of sleep as being a major contributing factor to adrenal insufficiency. Ideally, all of us, including our kids, should be in bed by 10 p.m. because physical repair of the body generally takes place between the hours of 10 and 2 a.m. Because of the production of human growth hormone that happens in that period of time. And then what's called psychic regeneration, which is just the reestablishment of normal brain electrical activity and brain function, generally occurs between the hours of 2 a.m. and 6 a.m. About 3 hours after dark, the output of adrenocorticotropic hormone, ACTH, from the pituitary gland decreases. And this actually allows for the cortisol levels to come down. If you notice if you look I don't have one in front of me, apologize, but if we go back to one of those slides where we looked at the cortisol levels, you'll notice that the cortisol levels are highest in the morning, and as the day progresses, the cortisol levels start to drop off. So by the time we go to bed, our cortisol levels are actually at the lowest. And that's important because as the cortisol drops, we get a corresponding increase in human growth hormone. And that human growth hormone is there to help repair and regenerate the body tissue that's been essentially damaged throughout the day. When our cortisol levels are chronically elevated at nighttime, it's not only going to interfere with sleep, but it's going to inhibit our body's ability to repair and our brain and nervous system from repairing itself as well. And then, of course, exercise is a big part of this too. There's a lot of research with respects to exercise and depression. I happen to think that exercise, even moderate exercise, is a great boost for anybody with a mental health challenge. I also feel that exercise is a great benefit for kids on the autism spectrum too. I know it's not always easy and can be a challenge, but having kids physically active is important because I've seen kids who've been in therapy sessions all day long, and once they're done, now they're expected to, take a bath and go to bed. And, they're not getting enough either outdoor time or enough free time or exercise. And again, I know everybody's a little bit different, but I think exercise needs to be emphasized more for anybody dealing with these kinds of issues. Okay, so let's wrap up here and talk about adrenal therapy and some examples of adrenal therapy. New Beginnings is a company that I've used for years. They've had a great line of products that are very, very helpful for parents who have kids on the autism spectrum. They also have a great line of products for individuals who are dealing with mental health issues as well, and some of those remedies like methylfolate, etc., can be crossed over to the kids on the spectrum. They actually have some great products with respects to adrenal support. This particular product, called Adrenal Essence, is a combination of different adrenal supportive herbs, cordyceps, ashwagandha, Siberian ginseng, etc. And it's a nice remedy, herbal remedy, to just support adrenal function. Okay, so anybody who's under stress can look at a remedy like this as supportive. Now, it talks about 2 capsules daily. Some of these supplements like this, particularly herbal remedies, are difficult to know how much to use because they're not dose specific based on age or weight. So it's not like this. There's you can only use 1 capsule or 2 capsules, but on average, okay, for most kids and most adults, an average would be 2 capsules a day. Does it mean you couldn't go higher? I've certainly dosed higher. Usually with most of these kind of remedies, I might dose anywhere between 2 to 4 capsules per day, okay, with on average being 2. There's also a nice remedy called Energy Plus, which is a comprehensive herbal blend that is specifically supportive not only to the adrenals, but the immune as well as cellular energy metabolism. So these are sort of a nice combination of things to use. Again, 1 to 2 tablets, 1 to twice daily. In most people, if I'm just starting off with supplement recommendations, I might start with 1 tablet a day for 24 to 48 hours, then add in a 2nd capsule, and then take it from there. So I usually don't start off with a real high dose right away. So those are a couple nice things. There are a couple other products that I've used. This Adrenal Cortex is a nice remedy. There are other companies out there, by the way, other than Allergy Research. This is a bovine cortex glandular, and so this actually has within that cortex some of those hormones that are depleted with adrenal insufficiency. I've actually used this with good success in some kids on the spectrum. 1 to 2 capsules daily is about all that's needed. It's just a general support. If you have a child who is real sensitive to supplements, you know, because of the herbal supplements, maybe they've got an oxalate issue or they've got some phenol, more specifically like phenol sensitivities, you're not quite sure if they can take a combination herbal remedy. This adrenal, you know, cortex glandular is real nice. These are not carried by New Beginnings, by the way, but I can show you where to get these. And then this Isocort remedy is great. It's plant-derived cortisol. It has a little bit of echinacea in it, but it's primarily plant-derived cortisol. And this is a great remedy for adrenal support as well, because it's actually giving at least a very, very small amount cortisol, and you can time it to a specific time during the day. The adrenal glandular support, the nice thing about that is it does not contain DHEA, so it's safe to give to kids, because in little kids we're trying to stay away from DHEA because the DHEA in a lot of children hasn't fully kicked in yet, and because it's also a precursor to testosterone and estrogen. Isocort, there's a couple places that you can look for this. One is from a company called Biomatrix 1. There's 6 milligram tablets per with respect to the Isocort, but I wouldn't just arbitrarily start giving Isocort, okay? I like to back it up with some data based on an adrenal test to know exactly where to give the Isocort and how much, because do we have elevated or low cortisol in the morning? Is it in the afternoon? Is it all throughout the day? Because Isocort is really something that would be specifically linked to where in the day you'd want to give it. It wouldn't just be sort of arbitrarily throwing it in, you know, once a day or twice a day. It's best tied to a specific adrenal test. These remedies are also available to individuals who are part of my membership website at autismactionplan.com, and I can actually help guide you in how to implement these specific supplements too, if that's something that you feel like you need help with. So, well, let me finish up with just this thought here as far as some additional supplements. B-complex vitamins are very important for adrenal health. We know that a lot of kids on the autism spectrum receive benefit from B-complex, B6, and B12. Certainly individuals with mental health issues, chronic stress, etc., are often depleted in B vitamins. Basic Nutrients Plus is a great B-complex vitamin/mineral that can be useful as part of an overall adrenal support program. Actually, the Basic Nutrients Plus is part of New Beginnings starter packet for the kids on the spectrum. It's generally given with some zinc, some other minerals called chelate mate, which is a liquid mineral, some cod liver oil, and that makes up their starter packet. So this is a good remedy, but adults can take this too. NADH is an interesting remedy. Nicotinamide adenine dinucleotide. This is a supplement and a chemical that's very important for energy production at the cellular level. Interesting is that it's responsible in part for glutathione recycling, and we know that glutathione is often quite deficient in kids on the autism spectrum. It assists in brain chemistry production. Years ago, it was being touted as sort of the magic supplement for chronic fatigue syndrome, and I think as people realize, there is no magic supplement for chronic fatigue, just like there isn't a magic supplement for any disorder. This is why a comprehensive biomedical approach is so important. But this could be a useful remedy for overall energy support. It's also part of what's called a mitochondrial cocktail. NADH along with CoQ10 along with carnitine is often given in combination for individuals who are thought to have or have documented deficiencies in mitochondrial or mitochondrial function, which is something that can actually be detected from an organic acid test from Great Plains. CoQ10 is a great remedy. It's very important very specific for mitochondrial function. It's great for states of energy and stress. The remedy that I typically use, something called ubiquinol, is the reduced form of CoQ10, and it, I dose it anywhere between 1 to 2, sometimes 4 capsules. Most of the time, if I'm using 4 capsules, that might be an adult. But 1 to 2 capsules per day for the kids works very, very well and is good for overall states of stress. Let me come back here real quickly just to wrap up on dosing of things specific to an adrenal test. The vast majority of doctors, when they want to do an adrenal test, they'll do a blood sample in the morning and look at total cortisol level. Okay, so if a patient comes into a doctor's office and the doctor has a high suspicion of an adrenal problem, they're going to send the patient to the lab and they're going to do a total cortisol. Or they might do a free cortisol, but a one-time test, and they'll see if it's low. If it's low, they may do a test called an ACTH stimulation test, where they actually inject a synthetic version of corticotropin releasing factor to try to stimulate the pituitary to output ACTH. And they want to see if the adrenals will then respond to that ACTH stimulation. Now you can also do an ACTH blood level. You can do an aldosterone blood level. You can do blood checks on most of these hormones. And if it comes back where these things are low, then often that patient will be diagnosed with Addison's disease. And then they will be put on a course of treatment, whether it's prednisone, hydrocortisone, aldosterone derivatives, to try to bring those levels up. So that would be sort of a traditional medical intervention for severe adrenal insufficiency, Addison's. The problem is that traditional medicine often doesn't recognize the different stages of adrenal insufficiency because they often don't do the saliva testing. They're solely reliant upon blood testing. The problem with blood testing, one of the issues with blood testing is that most patients don't want to go to the lab to have their blood drawn. In some individuals, getting their blood drawn is incredibly stressful, and I've seen this with the kids on the spectrum. Some of the kids, it's virtually impossible to get blood drawn from them, or if it is, they have to have 5 adults hold them down. And so that in itself can induce the overproduction of cortisol to where on the test it could be normal. The beautiful thing about salivary adrenal testing is it's done in real time, it's done in the home, and it's done on a typical day, and it's spaced throughout the day. You're also getting the free fraction, the physiologically active form of that hormone. And the nice thing about getting that information is that it allows you to then intervene with specific supplementation at specific time. For example, on this particular test, morning, noon, afternoon, nighttime are all low. Okay, well, we could give a general adrenal support remedy, like the Adrenal Essence, for example, which is the herbal blend, or the Energy Plus as a general support, or the adrenal glandular product I talked about, and that's going to give an overall adrenal support, and not a bad thing to do. But you could also use specific hydrocortisone or isocort specifically tied to each level. So maybe we use isocort in the morning, in the noon, but maybe let's say the afternoon level is normal, so we don't really need to use it at that time. If it's real severe, sometimes I'll prescribe compounded hydrocortisone from a compounding pharmacy. Hydrocortisone, 12 milligrams of hydrocortisone is equivalent to prednisone. So what we're doing when we're using hydrocortisone is you're using a much lower potency than prednisone, which is synthetic cortisone. And you're actually using the physiologically active form because hydrocortisone is equivalent to cortisol in the body. So you're essentially, it's like using when women get compounded hormones for estrogen or progesterone, you're actually getting the physiologically equivalent hormone that your body is producing. The same thing can happen with hydrocortisone, but that's prescription. But the isocort as a supplement is plant-derived cortisol. That can be used to time specifically to these different levels as well. So the isocort to me is something that I usually hold off on unless I have a test to know exactly where to give it and how much to give. But the adrenal glandulars, the adrenal essence, the energy plus, those adrenal support remedies in general, the B complex, etc., are definitely worthwhile to use for essentially anybody who may be under chronic stress. So what are some of the common improvements that we see across the board with adrenal therapy? Well, adults as well as kids generally are more calm, they have better sleep, there's improved energy, less stress and tension, less physical pain, less inflammation and swelling. For adults, primarily less susceptibility to injuries. There's a lessening or elimination of moodiness, irritability, anxiety, depression. In adults, we often see an improvement in a desire to participate in daily activities. That's obviously a telltale sign of somebody with depression. So these are some of the common things that we see as we start to work on the adrenals and bring those cortisol levels back up to normal. Now, in the near future, I'm going to be talking about thyroid function with respect to autism, and we can also link that into mental health disorders as well, because we know that that is an important link hormonally as well as metabolically. But in my view, the two need to be essentially, if possible, looked at and addressed simultaneously. Again, some of the adrenal testing, the salivary testing can be a bit of a challenge with some of the kids because it's difficult to get saliva from them. It's obviously easier to do with older kids who can spit into a vial, or adults who have no problem collecting saliva from. But I wanted to introduce this concept of adrenal insufficiency across the board for kids on the spectrum as well as other patients as well, because it's a very important thing to understand and a very important thing to start looking at addressing as time goes on. So with that, I appreciated everybody's attention tonight. If you are a parent of a child on the autism spectrum and you have questions, you can reach me on an ongoing basis, on a daily basis if you choose, through Autism Action Plan. Autism Action Plan has been in existence for about 3+ years. It's a very active parent forum. I'm answering questions on a daily basis. If you're a parent who has a doctor but you like to get a second opinion, or you just want to ask me a question about something, great place to do it. If you're a parent out there trying to do a lot of this on your own, you want to reach out and have somebody give you some feedback, this is what I do. So Autism Action Plan is there. And there's a lot of other information on this site as well. And then again, if you want to get more information about me, my practice, my consulting services, you can do so through drwoeller.com. And again, you can enter your name and email address there to get on our mailing list. So with that, we will talk to you again in a month. I appreciate everybody's attention tonight. If you did submit a question, don't worry, those questions are taken by Great Plains, and then they'll email them to me, and then I'll answer back, and you'll get those questions back in a few days. So everybody, I hope you enjoyed this tonight, and I hope you found this information useful, and we will talk to you in a month. Okay? Take care.